Hi guys, this is Physiopedia, and for today's video, I will be teaching you on how to unjam a finger. Without further ado, let's dive into it. When you jam your finger while playing a basketball, what happens is these structures here will become compressed, or possibly the ligaments found on the lateral side will become stretched or torn. We can expect a compression forces down to this joint. When it becomes stretched this way, this stress or forces could lead to stretching the ligaments here or possibly tearing. For example, when you stretch here, the ligaments become stretched, then this side, this joint will become compressed. This could lead some difficulty moving. So what we need to do in the first few minutes, we need to rest, put ice compress for 15 to 20 minutes every 4 hours. Put some elastic bandage to reduce the swelling of this joint and keep it elevated so that the blood flow will go down. And after a few days, after 3 to 5 days, you can introduce some range of motion exercises. But again, if the pain or the movement has no progress, you can apply this technique, which I call the unjamming technique of a jam finger. For example, if you have compression forces here, then tearing of the ligaments here, make sure give this time to heal. But if you have pain on the first few weeks but still no improvement, you can apply this technique. So what we need to do is just hold this part, so not this joint, this part only, with your 2 hands, and maintain a distraction or force on your arm. Upon doing this, you can feel a stretch or distraction in your joint. This is very good, especially if the joint has been compressed. And you can also apply this on the first few hours if you want some joint pain relief. As distract, and apply a downward and upward oscillation force. This is what we call joint manipulation technique, just to provide pain relief. Maintain a distraction, lie here, then do a downward force.